Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brian Hamilton.
Welcome to the Healthcare Security Cast for Tuesday, February the 4th. I'm your host, Brian Hamilton. If you'll be in the Toronto, Ontario area, Wednesday, March 11th, the IAHSS Ontario chapter is hosting an education event. We have a great lineup of speakers, including IAHSS President-elect Paul Sarnice. This is a free event, and links will be included in the description to register. The IAHSS Ontario chapter will also be hosting the 16th Annual Golf Classic. This will be happening on Monday, July the 13th at the Summit Golf and Country Club. Stay tuned for more information and links to this event as well. If you have a healthcare security event that you'd like me to mention on the podcast, connect with me by sending a direct message on social media. I can be connected with on LinkedIn, Twitter, Instagram, TikTok, and Facebook. My name again is Brian, B-R-I-N-E, Hamilton. I'll be the only Brian Hamilton on any of these platforms, so I'll be really easy to find. Also, if you want to connect with the Healthcare Security Cast community, we do have a group page on LinkedIn as well as on Facebook. On today's podcast, I'm joined by Caroline Ramsey-Hamilton, and she'll be talking to us about the coronavirus and just what to expect, how to prepare, things of that nature. And now, let's get into the conversation. Thank you for joining us today, Caroline.
Thanks, Brian. It's great to be here.
Now let's start with, let's start off talking about you. Who is Caroline Ramsey-Hamilton?
Well, I'm a person who grew up in Southern California, graduated from University of California, ran an ad agency there after I graduated, started doing interesting things with campaigns and algorithms and numbers, and started doing forecasting for political campaigns. And in my work, I elected a DOD person who was from Washington, D.C., and they liked my algorithms. So they brought me back to Washington, D.C. to work on a risk assessment project for the FBI that was moving all their criminal justice records out to West Virginia, the criminal justice project out there. With all the IDs of everybody all over the world. And fingerprint, the whole fingerprint library was digitized at that point too. So that's how I got to Washington, D.C. And once I was there, I just started working with companies, mostly about doing security risk assessments that went to all sorts of different applications. Everything from, we did railroads, did all the courthouses in the United States, the nuclear reactors, nuclear process power plants, Department of Interior, all the dams in the United States. By the way, there's 77,000 dams in the United States. And then I got involved in healthcare, and so that's how I met you. And so I do a lot of work with hospitals and also a lot with behavioral health organizations now too.
Excellent. And so obviously today, yesterday you had sent out an alert about the coronavirus and just given some updates about the status of that. I guess let's start off by asking, what exactly is the virus? I know it's new for a lot of people, so can you tell us a little bit about the coronavirus itself?
Yeah, the coronavirus it's a virus that's found in wild animals. And so in that way, it's similar to the SARS virus that we had already, and also the MERS virus, MERS, that's still very active in the Middle East, and it comes from wild animals. So some people think that this virus came from a bat cave. Other people think that it originated in China in the Wuhan province, and it came from butchering wild animals in the marketplaces, and some kind of a bloodborne pathogen came out of that. They call it corona, not after the beer, but the structure of the virus, when you look at it under a microscope, it looks like a little crown, and that's why they call it corona. but it's a influenza type virus. So it's not GI tract, it's respiratory, sneezing, coughing, lung congestion, sore throat, things like that.
Okay, and what are some of the symptoms of it?
The number one symptom is having a fever, and that's why in China now, we'll get to why I care about it, but basically when you go to the grocery store there now, even in Beijing, they take your temperature before they let you into the store because the temperature is one defining feature. The other is having a cough, sneezing, being short of breath, having a runny nose or a sore throat or something like that. And the reason why it's hard to control is because the symptoms don't show up for 2 weeks, 14 days. And so that means somebody can be highly contagious and go to the store and the movie theater and everything and spread the virus everywhere where they go.
All right, and obviously hand washing and just proper hand hygiene is really important with preventing any disease, really. What are some of the other ways we can protect ourselves?
Well, what they recommend is to wash your hands every 2 or 3 hours. Make with and if you can't wash them with soap and water for at least a minute, so like time yourself while you're washing your hands to make sure everything stays off of them. But also carry some of those disinfectants that come in a little like a gel, like Purell that comes in a bottle, and use it frequently every time you touch anything. So you go to the grocery store, you take a hand sanitizer, that hand sanitizer stuff, put it on a Kleenex, run it over the cart. Everything you touch, if you exchange money with somebody, you clean the money after you're done with it. You just make sure that anything you touch goes with that. That's probably the best thing that you can do. And the other thing is just to stay away from other people because if you're not exposed to anybody, you can't get infected, right?
Right. Now you've taken a bit of a personal interest in this as well. Can you talk a little bit about that?
Yeah, I can. The reason I care so much is because I have my one of my favorite nephews got married in March, and he and his wife moved to Beijing because she's a newscaster for a big media company, and she's a commentator. And so they were so excited to go over there. And now she's on her broadcast. She's wearing a mask. She's sending me pictures of the streets in Beijing that are empty, the malls that are completely empty, not one person in them. And also, I saw a picture of a commuter train with one person in the car. So people are getting they're just, everybody's staying home. And she went to the grocery store and she had her temperature taken to get into the grocery store. So they're holed up in their apartment and they're working from home. And so she's sending in her stories from home and there's no travel. And that's what one of the things they're going to recommend is that if you know that there's likely to be the, the epidemic is going to come to where you are, you want to make uh, advance arrangements to be able to work at home during that time, so you don't have to travel someplace, especially if you use public transportation like the metro in Washington D.C. or Amtrak or something like that. You don't want to be doing that during when these things are live and they're spreading.
Of course. And also yesterday, you had sent out an alert that the World Health Organization declared a global emergency. What is the current state of the coronavirus in China and other parts of the world?
Yeah, well, they yesterday, the WHO, they declared a global emergency yesterday, and today, this morning, the U.S. declared a national emergency, and they they expanded that by saying anybody who's coming from China is going to be isolated for 2 or 3 weeks on their return to the U.S. And Australia's gotten a lot of criticism because they set up a separate island for travelers from China because there's a lot of China's close to Australia. They do a lot of trade. They have a lot of people who live there. And so they set up a separate island to keep them completely isolated. When they come back, they have to go to the island first. And Health and Human Services here has a pandemic influenza plan that you can look up on the internet if you need some guidance about how to do that. But the current state of it is that they've had 9,800 infections that are confirmed that it was that this coronavirus, and 200 of those people have died. So that So it's not like SARS. It's not highly contagious that everybody who touches it, or like Ebola that dies. But it's low level, but and also, of course, it would tend to hit more people who have compromised immune systems. Babies, uh, older people, people in nursing homes, and things like that, which is one of the things people are very worried about. So also in the U.S. today, the stock market dropped 560 points, which is a lot. And this was after Delta Airlines, American Airlines, and United suspended all their flights to and from China. And they also evacuated all the Americans from Wuhan, which is where they think it originated. And they quarantined them at March Air Force Base out in California. And it's actually near the university that I graduated from. So they these are the numbers. So they've had 8,000 cases confirmed in China now. But I read a think tank that said they expect to hit over 14,000 cases in the next 10 days. And almost every country in Asia now has a couple of dozen cases, and there's six, I think, in the U.S. as of today.
Yeah, that's definitely going to have an impact on, well, just on healthcare facilities in general. Uh, what are some of the challenges that you anticipate the hospitals are going to have with dealing with this?
Well, I was around for the Ebola virus. I worked with quite a few hospitals during that time, and it's very tough. And of course, nursing homes are even worse because they're full of people who have compromised immune systems. And so one of the things that I worked with one of my hospitals, and when the Joint Commission came in, was to change the footprint of how people get into a hospital. So the way it's set up now is people come up to the hospital, they look for the emergency room sign, and they walk in the door. And that's not going to work if you have a lot of people coming in for with contagious diseases. So it's depending on the time of the year. The other time it was summer, now it's winter. But you could do everything from having a screening tent out. One of those tents that it's not like a camping tent. It has poles, like four poles holding it up. Has a door you could walk into, and make it like a triage area where you can look at the people, and if they come in and they say, and they have a runny nose and they're sneezing and they're coughing, that you could take their temperature and put them in a room that is going to be designated for emergency influenza cases. It could be another tent, it could be a room in the hospital. But again, what you have to think about is you don't want it to be a room where you have to walk by patient rooms to get there. So you want to have as little contact as possible with everybody else who's already in the hospital. And that means you have to have it designate another room for that, or you have to put them you have to move the regular ER to some other place and let those people use the ER because it may have the negative airflow and things already set up there. So you have to. I think most hospitals probably have what they did on Ebola, and they probably have the plans that they used then because I helped some hospitals work on plans like that. And so you need to get those plans out. So part of it is how people move around in the hospital. And because these people are going to be highly contagious, you don't want them to be touching anything that the other patients are touching, like even a bathroom in the emergency room. You don't want them in there. You want them to be in their own space. And of course, the other thing is what other supplies you need to deal with this.
I know that's been one thing that's been a bit of a theme here. I've had people sending messages saying, buy your masks on Amazon. Make sure you have them because there's going to be a shortfall of them. So is that something that you've anticipated, or is that something that you're seeing?
Yes, it's something I'm seeing, and I looked on Amazon today, and they're sold out of a lot of masks already, which is pretty amazing. And you really need more than a mask. If it's an airborne virus, it's the mask is really not going to protect you, because when I see people, you could look at the media coverage of it, you can see the masks are open on the top, they're open on the sides. So, if somebody touches you, the virus can still get in there, even if you shake hands with somebody or take money from somebody, then touch your own cheek or face. So you really, if it would get really bad, you would need some kind of a respirator device. It's more than a mask, where it covers you like a diving mask almost, but has an air filter in it. They also still have protective. You can buy a full Ebola suit on Amazon for like $135. So they have those kind of things available too. The other thing that some of the places in China are running out of is disinfectant to wash down the hallways. And one of the stores that we talked to in China, they say that they claim that they're washing down everything every 2 hours. So every 2 hours they take a mop and they go through the store. They wash the entrances, they wash all the railings, they wash all the carts, everything. And so that's like quarts and quarts of disinfectant. And I heard that there are a lot of trucks that are going into the Wuhan province, and they're taking disinfectant in there, and they're running short of it. So that's another thing that you need to order early. And I always think, you can always return it if this goes away, but it's a great idea to have it on hand in case it doesn't.
Okay, and you mentioned obviously that we're already seeing a kind of a shortfall with the PPE. What are some of the other challenges we can expect to encounter moving forward?
Well, I grouped it into two areas. One is challenge for an individual, and the other is a challenge for the hospital or the healthcare, the nursing home, or whatever. So for an individual, I think it's sort of standard. As you will recognize emergency response, which is you need to go now to a pharmacy and get an extra month of all your prescriptions, just not because the pharmacies are all going to shut down, but because the supply of these things coming in might get held up at some point. So it's always good to keep an extra refill of all your prescriptions at home, keep the supplies. Like one of my friends called me this morning in Maryland and said she was going out to buy a bunch of rice and beans to have on hand, and canned food, soup, and things like that. And I grew up in California where we had earthquakes all the time, so I always have enough food for 3 weeks. And also, don't forget about your pets, because pet pet stores may not deliver like they do right now. So that's another thing you want to make sure is you have enough food to take care of your pets, for 2 or 3 weeks. You basically want to be able to stay at home for 3 weeks or a month and not ever have to go out. And that means keeping the kind of food that you need, having your prescriptions. I have a kit that I keep, and I also include like antacids, diarrhea medicine, Pepto Bismol, chewable Pepto Bismol, uh, aspirin, the kind of things that you'd run out to get. And if you can't run out because the big box stores are closed, you need to have those things in your house. And it's a good thing to teach your children just to be prepared. So for healthcare, it's even tougher because it's you don't know when the virus is going to spike. Is it going to be next week, 2 weeks, 3 weeks? You have no idea, and you have no way to tell how many people are going to show up at your hospital. So that's why the first step is creating paths for people to enter the hospital. And during the Ebola panic, we even worked with parking services to be able to get masks for the people who were parking, and having all valet parking. So you can't just park your car and walk in. You have to come through the valet, and you get a piece of paper. And if the valet notices that you're sneezing and your nose is running and you're coughing, they give you a piece of paper and say, okay, follow the red line on the ground, to get to the influenza area. And then the regular ER lady who's about to have a baby, she's going to get dropped off at the emergency room. She's going to get wheeled in with a yellow line. So have to create a path and signage for people so they know where they're going to go. And you may even, well, I would think most hospitals already have that left over from Ebola and probably from SARS too. And just like, we order extra supplies of masks and things like that, the hospital should go back and look and see what it's got left over from last time. And also, I would order extra disinfectant by the gallon. I'd order extra masks. And you need to have HR or compliance adjust your policies and procedures too. I assume that there are already some in place, but they may be coming out with new ones too. And you can, if you're a healthcare organization, the CDC on their website, they also have a place where you could go and look. And I'm sure Canada Public Safety Agency has
Okay, and I guess is there any other advice you have for individuals just to kind of prepare us for what's to come?
Uh, I remember I mentioned before getting permission to work at home ahead of time. So, if there's some reason why you can't go to work, especially if you take public transportation to work and there's a chance that that could be shut down, you want to make arrangements, bring the work home so you can work wherever you are. You have enough food and water for you and your pets. Uh, do the kind thing, check in on your neighbors who might need help, and download the information that you need ahead of time. So make like, same thing we do in a hospital. Take a 3-ring binder and download all the information you need, put it 3-hole punch it and put it in that binder. So if the internet should go down, you have it all out. It's printed and it's ready for you to refer to and use. And I would also, if you're listening to this, and you can go to the CDC or Canada's Public Health Agency and look every day and see if there are more cases. And if it looks like there's an upward trajectory, like there's 6 today and there are 12 on Saturday and there are 36 a week from then, get your backup supplies early. Don't wait until you have 100 cases a day. Don't wait and say, okay, well, I'll do it next week. I'm not really sure what to get. Just go out and get the stuff now. You can always use it next time, or get your money back for it. But I would get all those things assembled in advance where you know where they are. Make your 3-ring binder, your emergency plan, and don't panic, because we've been through this many times before. The SARS was a really bad one. It was in the only good thing about this virus, coronavirus, is that it's not as lethal as some of these other viruses are that kill. Ebola was like, I think 60% of the people who get Ebola die. And this is not that bad. It's not as bad as that. It's not good, but it's not as bad as that. So I just think it's making so that you don't have to, you're not around a lot of people. You can stay home. If you're the kind of person like you're a single guy and you're going out to restaurants and eating every night, I would not do that. I would get what you need to eat, even protein bars every night, and have it at your house. Because what you want to do is you don't want to see any other people. You don't want to touch where any other people have been. You don't want to put your hand on a doorknob that somebody else has opened. And so that's the kind of thing that I was thinking about.
Now, one other thing for all the folks out there like myself who are parents, uh, what other what other concerns should we potentially have about school shutdowns? Is that something that you think could potentially happen?
I think it could happen. I mean, I have 2 grandchildren who are 10 years old, twins, and they often bring home to me, the colds and things like that. And so I would think with a highly contagious virus that it's doubly hard to get kids to wash their hands even once a day, much less every 2 or 3 hours. And also there's a lot of close contact and touching between children. A lot of, they're sitting, not like a store where you walk in and then you get your groceries and you walk out. This is, you walk in, you sit at a desk that other people sat on an hour ago. So a lot more transmission. So I guess if I had kids that were in school, and what I will tell the kids I have is, wash your hands and give them some of that Purell in a little jar that they can take to school with them and sit down with them. Show them how to use it on a table. How to clean a table off. Get some of those little boxes of Kleenex for them to put in, so they can clean off whatever they're using if they're, playing on playground equipment or something like that. I think that would help. It's probably not going to be perfect, and if it gets very extensive, I'm sure they will close the schools. But I hope that that doesn't happen. But I think it's just better to be safe than sorry. You never know where the kids spent the weekend, So it's the other kids. It's always a good idea to teach them how to take care of themselves like this early.
Is there anything that you're working on that you'd like to talk about at this time?
Yeah, if anybody wants to sign up for my risk alerts, we'll be sending out bulletins every 2 or 3 days about this. And you can just look for Caroline Ramsey-Hamilton on LinkedIn, and you can also contact the CDC in the U.S., cdc.gov, or you could the Canadian Public Health Agency, And if you want to contact me by email, which is fine, I'm going to be doing some webinars about this next week, all next week. I think I'm going to have 6 webinars next week. And my email address is caroline@riskandsecuritylllc.com. And that's how you can get a hold of me. And I'll be happy to pass whatever information I have on to whoever's interested.
Okay, great. And we'll have all those links in the description as well to make it that much easier for you. All right. Well, thank you very much for doing this, Caroline. I appreciate you taking the time.
No problem. Thank you for inviting me. I enjoyed it.
And this concludes another episode of the Healthcare Security Cast. Thank you for joining us today. And again, I'm just going to remind everybody to connect with us on social media. We do have a LinkedIn group page as well as a Facebook page. And feel free to connect with me on social media. Again, my name is Brian, B-R-I-N-E Hamilton, and you can connect with me on LinkedIn, Instagram, Twitter, Facebook, and TikTok. Join us again next week when we have a new guest and a new topic. Until then, take care.